caregiver. The caregiver was there throughout the whole recuperative stage. Time was not an object. This person stopped working to take care of me. This person knew which medicine I needed and when I needed to take it. This person understood why I needed my surgery, what would be the consequences if I didn't have it, and what was the necessity to have things completed and at what time they were needed. From watching how I went to bed, to how I slept on my stomach, to how I would go to the bathroom, this person was there for me. She helped me bathe. She groomed me. She helped me get dressed. She helped me go to my doctor visits. She watched my weight. She took my blood pressure. She took my temperature. And she made everything right for when the nurses came to visit me, to have all the stats available. This person helped me to walk when I couldn't walk. And when I started to walk, she was there to help me through the house, just to see if I could go an extra step or two. And then when I started doing that, okay, she said, go outside and start walking. When I was really still hurting, this person was there to make everything okay for me until it got better. And when the tears and the pain came, she was there to help me through that. There was never a time that I can remember that this person didn't have enough time in a day to be available to me. This person was always there. Until the doctor gave me permission to drive, she drove me everywhere. Everywhere. So I was sitting in the back like Mr. Daisy. 8 years ago, when I had a stroke, this person was there during the time when all I could say was yes and no. And when I had to learn how to read all over again from A, B, C, D, she was right there to help me with my speech therapist. In November, just last November, my doctors at San Francisco Kaiser Hospital completed a successful open heart valve replacement surgery on me, and she was there. Words cannot say thank you enough to this very special, considerate, patient, trustworthy, dedicated, and unselfish person that happens to be my wife. Brenda, she's the caregiver like no other person that I know. And the reason I'm standing here is not only God's help, but with her. She did everything, everything. All I can say is thank you, baby.
If you would, about the importance of caregivers in this day and age.
Sure. I think caregivers are really the foundation of what makes the world go around. To have that compassionate heart. One of the things that our founder, Brian Clemmer, wrote was a book called The Compassionate Samurai. And The Compassionate Samurai focuses on 10 traits that deal with having a warrior-like spirit out there in either your professional life or your personal life, but also marrying that up with compassion and letting the two do a dance of integrity. And I don't think there's anybody, caregiver is just such an amazing role, but you really have to be a warrior when you're up against life and bureaucracy, paperwork, all kinds of challenges. And so we'd like to really support the caregivers today. But where we really hang our hat on the experiential side is something called sunglasses or belief systems, all right? So I want you to suspend reality just for a second, or a few minutes. Pretend I was born. I'm 53 years old and I've had these sunglasses on for 53 years, all right? So everything I see is a shade of green. So will you work with me a second, sir? All right, what's your name?
Manny.
Manny?
Yeah.
Okay, so Manny, I love the shirt you have on today. In fact, when I drive back home today, I'd like to pick up that shirt for my husband. He looks so great in green. Your green shirt is amazing. So, can you tell me where you got your green shirt? So what would Manny say to that? It's white. What do you mean it's white? No, it's green. It's a green shirt. I see it with my own eyes. It's a green shirt, right? So Mary's going to start to motivate me and say, Kathy, sweetie, it's a white shirt. I'm going to call you every day and really motivate you about this white shirt. Kathy, it's white, 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 white. And she hangs up the phone. She does that 365 times a year, right? Will I be motivated to see Manny's shirt as white? No, I can only see it as green, right? Why can I only see it as green?
Because you're looking through green-colored glasses.
Right, I'm looking through green-colored glasses, and these glasses, as silly as they are, they represent my programs, my belief systems, the core of who I am inside. It lets me walk in the room and kind of size up a room, whether I like it or not. It lets me have a experience right away with how many males are in the room, how many females, what's the age demographic, how many blondes are in the room, how many people wear glasses, how many people have on purple shirts. It's just happening all within me when I go anywhere. And they go with me everywhere I go. So what if I really, really, really want to see Manny's shirt as white? Can that happen because I want it? No. Doesn't matter what I do, as long as I have these sunglasses on, these programs on, I will always see his shirt as green. But if I stumble across the sunglasses and I realize they're on my head, I can scratch the lenses, I can poke a hole through them, or I can simply take them off. And all of a sudden, I realize Manny has on a white shirt. I had no idea that was going on, but now I'm aware I can always see Manny's shirt as white. Now, I could try to go back to the green, but it's going to feel really uncomfortable. All right? And so that's what our workshops do. We stir up your programs a bit, let you become a detective around what's making you tick, and then you get to decide what sunglasses you're going to leave on and what sunglasses you want to take off in order to move forward in life.
I want caregivers to know that there are resources out there to help them, and that not only can these resources help them, but they can help the resources and help themselves in the process by getting involved, becoming an advocate, and it's a very tangible way to actually produce results in really a disease where right now there isn't a cure, there's only progressive disease, and with organizations like this, it's something that you can do to fix the problem.
Why are you here today?
I'm here today to raise awareness that there are alternative options for muscular dystrophy, and it just doesn't have to be involved with drug research, because this disease has been in my family for 73 years, and regarding modern research, we just haven't seen any progress. So our organization is dedicated to let people know there are other options.
What do you want to share with caregivers about dealing with mental health challenges?
In my challenges with bipolar disorder, early on, I didn't have much information or know where to go, but it was a group of advocates that had children that were dealing with bipolar disorder, and through that caretaking with their own children, they turned that to helping others and helping myself. So I think their first step was caretaking their own individual children, but yet it reached out into advocacy and helping others, and that was the benefit of that.
You have an amazing story of overcoming adversity. You are here today at a Caregiver Symposium. What is your message for people who are in that caregiving position?
As far as I'm concerned, what I've done in the past is just really share my talents, and that's what I've done, even though I'm going through a lot of pain with migraines and really debilitating chronic headaches. I use my talents in engineering to be able to volunteer. That's kind of what I do. I used to say I'm a part-time engineer and just a full-time volunteer, but giving back to the community and serving the community through volunteer service, even with community service and international service.
And you find that you get a lot out of that personally as well.
Yes, I do. I love being able to engineer some kind of structure to help others. I do a lot of work with Habitat for Humanity in here, and also trying to come up with an engineering program for kids as well, to create a pipeline of future engineers, and also translating that to international service.
My husband was a singer and a conductor. He had aphasia, which those of you who know, it's a speech impediment. His brain tumor was in the speech area. So there's that. But more importantly, as far as my talking today, is all the myriads of things that you have to deal with during the course of caring for a loved one. And as I mentioned, my husband had aphasia, so he couldn't talk very well. So the first challenge that I ran into was go find a speech therapist. He needs a speech therapist. Well, I had no clue where to find a speech therapist. And then the next thing was he started losing motor ability. Where do I find a physical therapist? And then, should I send him to a social interaction group? Because there were some in our area. Well, I did, actually. And in that case, as somebody said earlier, it was just wonderful to interact with some of the other people who had similar afflictions, but be able to show that he could do some things as well or better than some of the other folks. How do you choose a good nursing home when the time comes? It took us 3 nursing homes to find one that I thought was reasonably good. No one ever told us that my husband's case was terminal. So during all of this time, we were drifting and drifting and drifting. And when they finally told us that he should go into hospice, this is the hospital telling us it's time for hospice. It turns out that he did go to hospice. He went back to the nursing home. Hospice checked him out. 12 hours later, he had passed away. So that was another. So running into all of this stuff, it just really helps to be in a place like this where people are telling you about some of these things, and you can get ready for them, and you can and prepare yourselves to be able to ask some of the right questions that I didn't know to ask.
Determination to live, and no doctor was going to tell her she was going to live 6 months. So it has been 5 years almost to the day that she had the operation, and she's still going. She did go into chemo treatments. She had 79 chemo treatments. She now is not on chemo, and she's holding up well, but she faces it on a daily basis. She had CyberKnife done on her brain more than once, and radiation to her lungs. But you know, I never heard her complain, ever, except once. One time it came out of her, she just boiled out, and I was the one there, and I was wise enough to keep my mouth shut and listen to her. And it all flowed out of her, and thank God that she was able to let it come out. And that's the only time in 5 years I ever heard her complain. She's the strong one. And so my message from her, and I asked her if I could speak today about her, and she said yes. And my message is to keep faith, to keep hope, and have that determination. And she rides that Harley. She puts her leathers on and she rides down the road. And that kept her. That kept that hope up for her. And prayers and love from her friends and family.
One of the things that I'm most proud of, though, is that I always give thanks to the caregiver. And I had to learn it, it seems like, from every angle, right?
Yep.
And so now we just recently had our 6th annual Caring for the Caregiver Symposium. And we've been bringing in great speakers, great resources, and a day of love and respect for the caregivers and the role that they play in recovery. It's so important, wouldn't you say?
Yes, ma'am.